Hello everyone, welcome back. In this video, we will be discussing the dietary management of cardiovascular diseases, which plays a crucial role in both prevention and treatment. Let us begin with the basic dietary principles recommended for CVD. Dietary management is considered the first line of treatment for individuals with elevated blood cholesterol levels. A low-calorie diet with reduced total fat is recommended, particularly low saturated fat, low trans fat, and low dietary cholesterol intake. The diet should be rich in fibre, with a balanced omega-3 and omega-6 ratio of about 4 to 10:1, which supports cardiovascular health. A moderate carbohydrate intake with normal protein level is advised. In addition, a high fiber diet rich in antioxidants help in improving lipid profile and reducing oxidative stress. Energy requirement in cardiovascular diseases are calculated based on individual's body weight and weight management goals. In obese individual, a low-calorie diet is recommended to achieve desirable body weight. For cardiac patients, a mild and gradual weight loss is preferred rather than rapid weight reduction. In bedridden obese patient, a diet providing around 1000 to 1200 kilocalories per day is suggested. Regarding fat intake, total fat should not contribute more than 20% of total daily calories according to ICMR recommendations. The proportions of polyunsaturated fats to saturated fat should be maintained at approximately 0.8:1 to support cardiovascular health. PUFA or polyunsaturated fatty acids are important dietary fats. They play a protective role in cardiovascular health. The major omega-3 fatty acids include alpha-linolenic acid, EPA, and DHA, while omega-6 fatty acids include linolenic acid and arachidonic acid. PUFA help in improved cholesterol metabolism and reducing serum cholesterol levels. Arachidonic acid serves as a precursor for eicosanoids such as prostaglandins and prostacyclin, which are involved in regulating blood vessel functions and platelet activity. Overall, inclusion of PUFA in diet supports health by reducing cholesterol accumulation in blood vessels. Different types of dietary fats have varying effects on cardiovascular health. Fish oil rich in EPA and DHA are known to increase HDL cholesterol and reduce plasma triglycerides by decreasing triglyceride synthesis in liver. They also improve endothelial function and have anti-inflammatory effect. Monounsaturated fats, mainly oleic acid, help lower LDL cholesterol while maintaining or even increasing LDL level without raising triglycerides. Common sources include olive oil, canola oil, and groundnut oil. Saturated fatty acids should be restricted in cardiac patients, and diets emphasizing monounsaturated fats are generally preferred for heart health. Dietary cholesterol influences blood cholesterol levels, mainly when diet is also high in saturated fats. Therefore, cholesterol intake should be restricted, and traditionally it is advised not to exceed about 300 milligrams per day, particularly in individuals with cardiovascular risk. Vegetarian diets are generally lower in saturated fats and cholesterol and are rich in dietary fiber. Fiber helps bind bile acids and increases cholesterol excretion from the body. In addition, vegetable oil helps reduce plasma cholesterol not only because of unsaturated fats but also due to presence of plant sterols, which reduce cholesterol absorption in the intestine. Using blended oil in diet helps achieve a better balance of omega-6 and omega-3 fatty acid, which is important for cardiovascular health. A balanced fatty acid intake may help in reduce the risk of atherosclerosis. In addition, using more than one type of edible oil provides a wider range of minor bioactive components naturally present in oil. These components may contribute antioxidant effect and offer additional protection to cardiovascular system. In cardiovascular disease, the diet should emphasize complex carbohydrates while limiting simple sugars. High intake of simple sugar is associated with lower HDL cholesterol, and reducing total carbohydrate intake as part of calorie restriction may help lower triglyceride level. Soluble fibers such as oats, psyllium, pectin, and sorghum are particularly beneficial as they help reduce LDL cholesterol, especially in individuals with high cholesterol levels. Study also suggests that low glycemic diets help preserve HDL cholesterol and may therefore reduce the risk of coronary heart disease. In cardiovascular disease, a normal amount of protein is recommended, while excess animal protein from high fat sources should be limited in atherosclerotic patients. As intake of animal and fatty food is reduced, there may be a risk of inadequate fat soluble vitamin intake, and this should be ensured through diet or supplement when required. Vitamin B6 and B12 and folic acid are important as they help lower homocysteine, a recognized cardiovascular risk factor. Vitamin C also supports cholesterol metabolism and helps maintain the natural integrity of blood vessels. In patients with hypertension, restriction of sodium intake is important for blood pressure control. Selenium levels may be reduced in cardiovascular conditions, so food rich in selenium can be included in the diet. Potassium play a key role in maintaining fluid balance and muscle contraction, and low potassium diet may contribute to high blood pressure. Fluid restriction is usually not necessary as long as sodium intake is appropriately restricted. In cardiovascular disease, total calorie intake should be restricted to maintain body weight to below standard level. The total fat intake needs to be reduced and foods rich in saturated and trans fat should be avoided. Fat should not contribute more than about 18 to 20% of the total energy intake. Mufa and Kufa are preferred, and small quantities of nuts such as almonds and walnuts can be included. Foods high in cholesterol should be limited, and egg consumption may be restricted to 2 to 3 per week. In patients with CVD, white meats such as chicken and fish can be safely incorporated into the diet, and low-fat dairy products are preferred to limit saturated fat intake, including at least 5 servings of fruits and vegetables. Daily helps meet fiber requirements and provide beneficial phytochemicals and antioxidants that support recovery and heart. Beverages like coffee and tea should be consumed in moderation. Recent research has highlighted some emerging concepts in dietary management of cardiovascular disease. Diet influences gut microbiota and production of metabolites such as TMAO, which have been linked to atherosclerosis and cardiovascular risk. Diet rich in plant food and dietary fiber help promote a healthier gut environment. Plant bioactive compounds such as plant sterols and polyphenols have been shown to reduce LDL cholesterol and support vascular health. Overall dietary patterns like Mediterranean and DASH diets, which emphasize fruits, vegetables, whole grains, healthy fats, and lean proteins, are strongly associated with cardiovascular risk. With this, we conclude the topic of cardiovascular disease. We have discussed the key concepts related to its development, clinical features, and dietary management. We conclude the topic of cardiovascular disease. Thank you for watching. Stay tuned for more videos in metabolic health series, including obesity and diabetes.